Hello, this is Dr. David Green, CEO of the Washington Pain Network. Today's topic is the indications for spinal discectomy surgery for sciatica. At any one point in time, 1 to 2% of the population suffers from sciatica, with most having no clue what they did as an inciting event. It's often not something dramatic, like, riding a jet ski or motorcycle fall. It may just be a sneeze, or maybe they woke up with it. And it's typically due to a slow disc degeneration that results in a tear of the disc, the outer layer here, with the inner part, the inner jelly, squeezing out. And that can pinch on a nerve root as it tries to get off from the spine, and it can spark up inflammation and then sciatica pain. The symptoms of sciatica vary between patients. It may include leg pain, could be a burning or pins and needles, electrical type sensation, could have some numbness, possibly some weakness, such as difficulty lifting up the foot, and rarely you can get incontinence. That's called cauda equina syndrome, and that's actually a surgical emergency. Initial treatments for sciatica typically consist of a short amount of bed rest. The week that we used to be in the literature is a bad idea. Over-the-counter medications such as anti-inflammatories and Tylenol, physical therapy, chiropractic, spinal decompression therapy have all shown to have good results potentially. Prescription medications may include Medrol dose pack, which is about a 5-day course of prednisone, should not be used often. Narcotic medications, muscle relaxers, neuropathic medications such as Neurontin or Lyrica. Interventional treatments may consist of trigger point injections for the spasms and aching, and then epidural injections, such as you see here, can be amazing to bathe this inflamed nerve root with soothing steroid medication. Now, indications for sciatica surgery, there are 3 types. There's absolute, where you got to have it. There's relative, where you should really think about it. And there's quality of life, which is basically you don't have to have it at all, but you may be in so much pain that it may be necessary. Absolute, when you have a large amount of pinching, such as that it causes cauda equina syndrome, and here you can see that, where you have a large central disc herniation going back, pinching big time on the spinal cord. This can lead to bowel and bladder incontinence, okay? And it needs to be fixed very quickly. It may cause irreversible incontinence and difficulty walking if it's not treated within 24 hours, all right? So that's really the one absolute when it comes to sciatica surgery. Now, when it comes to a relative indication, say for example you're pinching on the L5 nerve root with a disc herniation and you start having trouble lifting up your foot, okay? That's called a drop foot. So that can be watched for a time. However, the longer it's watched, then the potential exists for, even if a perfect surgery is done, it may never get better. So the question is, what is that time frame? Is it 6 weeks? Is it 12 weeks? We don't actually know. So you don't have to have surgery like tomorrow when that happens, but you should think about it before you start watching it too long. The other indication here for as a relative is if you have a partial foot drop and it gets worse to a total foot drop, that's a progressive neurologic deficit, and surgery should be highly considered. Now, for elective quality of life, now you're talking about something where you have just pain or numbness, and you try over 6 weeks of conservative treatment, which is some of the things we talked about before, decompression therapy, injections, and it's just not working. Then the question is, should you go ahead and just have the surgery? Less than 10% of patients will end up needing surgery for sciatica, and for those that opt for it, over 90% end up having good to excellent results. There was a landmark study back in 2006, Journal of American Medical Association, that looked at those who had surgery versus those who didn't for the elective quality of life, and the results were the same at the 1-year point. Those who did have surgery got rid of their pain faster, they got back to work faster, but they had surgery. There are some slight risks associated with that. The top non-operative pain management is with the Washington Pain Network. There are multiple clinics throughout the state. There's over 50 insurances accepted and over 25 treatment options in all, and this includes the various medications, the epidural injections, muscle relaxers or whatnot, for sciatica as well. There's over 90% average success rates by the board-certified award-winning doctors. Visit us online at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.